There's going to be a lot of content at the IDWeek 2015 meeting on antibiotic stewardship, and this is a very exciting conference for folks who are interested in antibiotic stewardship, both in hospital settings, in outpatient settings, and in long-term care settings. And yes, a lot of the discussion will revolve around implementation. How do you get this done? How do you improve antibiotic use, be it in an outpatient clinic, in a pediatrician's office, a doctor's office, in a hospital, in a long-term care setting. There'll be discussions about measurement. How do we measure the impact of what we're doing, both with respect to having stewardship programs in place in these various settings, but also the impact of the stewardship program. How do we measure the impact of what we're doing? We're also going to have some discussions on the different activities that are going on here in the United States, but also in other locations, particularly in the European Union. There's been a big push throughout Europe for improving antibiotic use. And so we have an entire session that will have experts from the United States and in Europe comparing and contrasting the different things that are going on in each of those areas. And hopefully there'll be an opportunity for each side to learn from the other and to take from that some of the lessons learned and be able to advance what's going on in their specific area. What I hope people leave IDWeek with this year is a real sense of just how important an issue this has become, with this national emphasis in the United States and in other countries as well on combating antibiotic resistance. I hope they leave with a good understanding that improving antibiotic use across the spectrum of care in outpatient facilities, nursing homes, hospitals, is really a critically important component of how we can combat antibiotic resistance. I hope they leave with a real sense that, infectious disease physicians are the folks who really need to be working to lead these efforts, need to be leading the country in identifying how we can make this happen, how we can improve antibiotic use throughout all these settings, and leave hopefully with some new ideas, some new strategies for specific ways that they can get that done in whatever practice setting that they're in.